things that we're going to do is teach you the basics of CPR. Why CPR, why it's so important. So it's great to be back here again. We're Kids Corner Preschool here in Clearwater. My name is Dave Selbach. I'm with LifeTech Instructional, and just as an instructor, many years in the medical field, worked over multiple cardiac arrests over the years, over 30 years working with the EMS system. But as an instructor, you got a professional that is teaching you, okay? And one of the things is that CPR. CPR, what does it stand for? Cardiopulmonary resuscitation, right? Cardio, heart, pulmonary, lungs. Resuscitation, of course, is good luck with the CP part of it and get them back alive again. Meaning, what can we do to help save someone's life? Now, American Heart has it. What is the most important thing in CPR today? And what we're focusing on is compressions. Compressions. Why compressions? Well, before we continue on that, in CPR, we got 3 different age groups. We got infants, we got children, and we got the adult age, right? We got 3 different age groups. Now, infant is newborn up to 1 year of age. A child is the ages of 1 up to 8 years of age, or we consider puberty now, and above that is considered adult CPR. So no matter what age group we're dealing with, right? When someone's heart stops beating, what is that blood flow doing? The blood flow is not flowing like it should, because we don't know where the blockages are occurring in someone's heart. Are they outside the heart where most heart attacks occur, or is it inside the heart where maybe the valves are malfunctioning in some way? So no matter what age group we're dealing with, when someone's heart stops beating, the blood is not flowing like it should. What's in our blood? Oxygen. Now, is the oxygen in the blood, is it dead or is it still alive? The oxygen is still alive in the blood, but it's not going to be alive forever, is it? American Heart says that with the adult, when someone goes in cardiac arrest, their oxygen is going to last about 4 to 6 minutes. A child's going to be about 3 minutes or less, and then an infant or a baby is going to be about maybe 1.5 minutes or less. Now, of course, give and take a few seconds here and there in case there's some medical conditions. Some people may have pneumonia, asthma, emphysema, congestive heart failure, or anything pulmonary-wise or cardiac-wise, because in reality, the only way that we know when someone's losing oxygen, what happens to the skin color? They start turning bluish, purplish, and it happens at the outer parts of the body, like the lips, the mouth, the face, and fingers and toes, and it works itself up to the heart. So, if the oxygen is still alive in the blood, it's not dead yet, right? Do you think I really need to give this person any more oxygen through our breathing in the beginning? Yes or no? No, they don't need it. All we got to do now is focusing on getting our hands in a person's chest, pushing hard, pushing deep, pushing fast, doing everything you can to get the blood and oxygen pumped to the person's heart to keep the person's brain alive. Because in reality, I don't care about the heart. The heart can be fixed with procedures and technology. What about your brain? 10 minutes, you're going to be what? Brain dead. Yeah. So the reason why AHA changed it from not doing airway and breathing in the beginning, but focusing on compressions first, is because of the oxygen that's still alive in the blood. We just got to start pumping on someone's heart, to start pumping it to the heart to keep the person's brain alive. Okay? So that's why we do those compressions and why compressions are so important. But keep in mind now, say if your EMS system, every city, every county is different in the response of EMS, isn't it, right? So in Pinellas County, of course, our EMS system is pretty quick in getting on scene, hopefully within between 4 and less than 7.5 minutes. Some other areas, EMS systems may take 8, 10, or even 15 minutes to get on scene. So what happens if the EMS system's not on scene, the person starts losing oxygen, they start turning blue and purple in color? What do you think we may have to consider to do now? We're going to have to give them some oxygen. And the only way they're going to be able to get some oxygen is by doing what? Doing some of the breathing now. Okay? So if you have to do some of the breathing, the algorithm is compressions, airway, and breathing. It's the CAB method of doing CPR, okay? So, if you didn't want to do the airway and breathing, that is okay. Because with the guideline, you can just focus on doing compressions only on someone's chest, okay? So, that's the reason why we do compressions, why compressions are important, just to kind of be repetitive about it, is because of the oxygen still alive in our blood. Let's go ahead and pump it to the person's heart to keep the person's brain alive. Ladies, you make the difference in saving someone's life because you're there, we're not. You called 911, we're responding to you. Now, as we get on scene, we provide further care from there. We take them to the hospital and do what they have to do. But what we haven't seen over the years is a high percentage of people surviving cardiac arrest just because you did the best thing by doing those compressions in the beginning. Does that make sense? Mm-hmm. And that's why we do those compressions.